Hello, everyone. Welcome to the Analytic Moment. I'm Quentin Fisher, CEO of Healthcare Analytics, and this is a series on artificial intelligence for healthcare service providers. We now know from last week's episode how we all use AI tools in our everyday life. Let's now talk about how we use this technology in our organizations. When thinking about how you would use predictive analytics for your organization, it's very important to clearly define the problem statement, what you're trying to solve. AI today is called narrow AI. It's very specific and it needs to be precise about the problem that you're trying to solve, as well as the impacts that it's going to have on the operations or on your clinical practice. So here's an easy way to think about predictive analytics use cases. If I only knew X in advance, it would mean Y to my organization. So that's a very simple kind of rule to use. So here's some examples of some high value use cases that we see in the market and some that we're using. First one, predicting patient appointment no-shows and late cancels. We're actually going to talk a bit more about this later. Second one, predicting patient risk scoring or treatment success scoring for specific diseases or conditions. A third one is preventing suicide and patient self-harm. A fourth one, predicting patient demand patterns, understand what's coming. And a fifth one, and moving more towards treating patients as customers, bolstering patient engagement and satisfaction. So that's just 5. We have some more listed on our website, hcanalytics.net. Head over to the news tab where that's listed. So now let's talk about the first one you mentioned, predicting patient appointment no-shows or late cancels. In community health centers, this accounts for about 30% of all appointments. It's important to take the late cancels as well as the no-shows into account, as if you don't have time to respond to a late cancels, it's effectively a no-show, right? So this 30% number has a huge impact on the patient accessibility. They can't get in because the schedule's full. Productivity for the clinicians, their schedule looks like Swiss cheese. And of course, profitability for the organization. And we've found that we can reduce the impact of no-shows on organizations by 20 to 30%. So if you have a 30% no-show, that's a 6 to 9% improvement in capacity. And if you have a patient backlog, that actually drops straight to the bottom line. Very little to no additional cost, but all that additional revenue. So how do we do this? We solve this with machine learning, and we use a mashup of data from your EHR and other systems, as well as demographic data. In fact, when we did this for one client, we looked at over 140 different factors. And these factors are called features in machine learning speak. What we ended up doing was developing several models to solve the problem. And each model uses a different combination of these features or factors. And the result is an algorithm. And the algorithm is actually a combination of all those features that are woven into a kind of mathematical fabric, right? And this is what the predictive power of this is the predictive algorithm, the interdependency of all these features. So now once you then come up with this great insight, you need to apply it. That is actually a lot harder than it sounds. Even when you can predict a specific appointment's show rate, there's actually a lot of work to do to figure out your specific scheduling and operational rules around that. In fact, initially we found very poor adoption when just the insight was given. It actually had to be taken to the next step. A next best action had to be developed in order for the solution to be fully incorporated and utilized. So what we ended up doing was taking these algorithms and embedding them into a recommendation engine so that the right intelligent scheduling options are provided. And it is really important to embed these the predictive analytics solution into the process. And once we did this, we saw a tremendous benefit, and you as well can with this approach. So now what we did today is we kind of went through, in summary, a list of high-value use cases for you guys to target and look at. We drilled into one of them, the no-show and late cancel predictions. And with that specifically, we identified the problem statement, the benefit, a high level on the solution approach, and then probably most important at the end is how to make it operational and drive that into your business. So next week, with all that being said, what we're going to talk about is what's happened in the world over the past few years to really make this technology accessible, and why now is the right time to adopt AI. Thanks for listening. Please subscribe to the channel and get on our mailing list at hcanalytics.net. Take care. Bye-bye.